So Astrid is an ASCM clinical exercise physiologist who has worked in the Children's Heart Center at the British Columbia Children's Hospital since 2006. She graduated from the University of British Columbia with a Master of Science degree in exercise physiology in 2005. Astrid is passionate about exercise in children. She's a NCCP Level 3 coach in field hockey and has a wealth of experience coaching at both regional and provincial level. She's now also working as a strength and conditioning coach with figure skaters in Vancouver. Her goal is to ensure that both healthy in children and those with chronic disease have plenty of opportunities to be active. And the title of her presentation today is Using Clinical Digital Messaging to Engage with Pediatric Transplant Recipients. Please go ahead, Astrid.
Thank you. So thank you for inviting me to speak. I am presenting work that I've been involved in with Dr. Catherine Armstrong and Dr. Stephen Rathgruber, who's one of our clinical fellows. So I have no disclosures. So adolescence marks an important time in the health journey of many patients. It is a time when teenagers start to disengage from their parents. It is also a time where they need to have an established relationship with their healthcare providers, but often they don't because parents are often the sole communicators with the healthcare team. And this creates a problem because a lack of adherence to medical advice and minimal engagement with the healthcare team leads to graft loss in about 10% of our transplant patients. Now, for those of you who don't work with teenagers or don't have them in your household, this is often a situation that we are faced with. A teenager comes into clinic and their face is glued to their phone. So we started to think about what would happen if we tried to engage our teenagers using mobile health options. So what we did was we performed a focus group with our congenital heart disease population. And we simply asked them, how do you want to communicate with your healthcare providers? And the overwhelming response was that they wanted to communicate with us via text message. So what we did is we partnered with a local company called WellTel. And WellTel is literally down the street from us. They're a Vancouver-based company. And they had a wealth of experience with text messaging in the healthcare setting. So WellTel is based on bidirectional web-based communication, and it's based on the concept of ask, don't tell. And this really helped to foster better communication with our adolescent patients. So there have been a host of publications in the field, but our work is based mostly on the work of Dr. Richard Lester, who's a co-founder in WellTel. He's an infectious disease specialist here in Vancouver, and he was working in Africa with HIV drug-resistant women. And he was working on the kind of the basic science side of things. And what he noticed was it didn't matter where women came from in Africa, they always had access to a phone. So it didn't matter if they were rural and lived in the bush, there was access to phone. And so this started his idea of engaging with his patients via text message. So since then, WellTel's received about $15 million in research funding and has been cited in about 50,000 references. So how WellTel works is that there's a weekly check-in message that's automated, and the patient receives a message simply saying, how are you? The patient replies, and the system triages the response into 4 categories using natural language processing. So responses are categorized into okay, not okay, unrecognized, or no response. And we as healthcare providers monitor the categorized responses, and we just focus on the not okay or the unrecognized patients. Evidence has shown that only 3 to 10% of patients require follow-up in any 1 week. So this is just what the WellTel platform looks like. So I sign into WellTel like I do into my email. I can see all of my patients on this side, and then their collated responses sit on the other side. And so I know who has an okay response, and then I just focus on the not okay or unrecognized responses. And WellTel meets all the privacy requirements of both our health authority and the university. So this led to an idea of trying to implement a SMS or text messaging platform to directly communicate with our adolescent solid organ transplant patients. And really we wanted to look at its effect on quality of life, medication compliance, and patient engagement. We approached 48 eligible patients and were able to enroll 23 patients onto the text messaging platform. So what did we find? 20 of the 23 patients were successfully able to use the platform. 3 patients experienced technical difficulties. To date, over 1,000 messages have been sent with 375 care conversations. So we define care conversations as any message thread that's over 2 messages back and forth. We were surprised to find that the quality of life was of our patients was so good prior to intervention. So this remained unchanged through the course of our intervention. We also noted that there was no significant change in tacrolimus levels. Again, that was because the tacrolimus levels were quite good from the onset. Interestingly, or more importantly, we found that 95% of our patients found that the text messaging service was very helpful. 90% felt that they were more engaged with the healthcare team. 15% said that the service helped them make better decisions about their medications, and 100% of patients said they would recommend the service to other transplant patients. So how this even transpired even further is that through COVID, we then had a direct means of communication with a good portion of our transplant population. And we were then able to do virtual consults with any patient that was supposed to come into clinic, because WellTel has a video call feature that allowed us to be able to quickly, seamlessly start working virtually with our patients. So up until COVID, I believe we had 90 patients registered onto the platform. And this platform then gained widespread use within the Division of Cardiology here and some other departments at BC Children's Hospital. And up until, I looked today, and we have now over 500 patients registered on the platform. So given our success with WellTel, we then thought, okay, well, how do we expand our services to exercise rehab services? So now it's our idea, or our idea to deliver a virtual exercise program using the video call feature of the WellTel platform. The exercise classes will be live streamed, and they'll also be available for on-demand playback. And this is really going to revolutionize how we provide exercise rehab services, especially in a geographically vast province like British Columbia. Patients will have access to their healthcare providers as questions and concerns arise, just as they do currently on the platform. And healthcare providers will have the ability to monitor behavior change goals, which can be tracked using the patient portal feature of the WellTel platform. Compliance will be measured by a number of classes attended. And if a live stream class is missed, we'll just simply ask the participant to text us a picture of them completing the recorded class. Engagement and acceptability will be assessed through response rate to weekly text messages and through patient interviews. I, again, would just like to acknowledge the work of Dr. Stephen Rathgaber and Dr. Jim Potts and Claire Galvin, who work with us in our research program, and Dr. Catherine Armstrong for her tireless work with this project. And we really would like to also acknowledge the WellTel team, including Dr. Gabrielle Serafini and Dr. Richard Lester, who have been amazing partners for us as we've tried to implement this text messaging platform for our population. Thank you.
Great. Thank you so much, Astrid, for your presentation. Great platform to keep in touch with the patients. So if anyone has questions, I think we have time for 1 or 2 questions maximum, that we're going to move to our breakout room for discussions. I have a question. So what type of, so are you planning to do it in group, to use the Zoom and engage the patients in group? And what type of exercise are you planning to deliver?
So the plan is to do sort of a strength and conditioning class, and the hope is that we would register a few kids at a time so that they have that group participation that's so important for rehab, for cardiac rehab, or for rehab as a whole, and just to have that engagement with our kids. So yeah, the plan is to try and get a bunch of kids to get on at the same time.
Okay, and what are you planning to assess? Is this a research project or a clinical program?
We're hoping to do it as a research project and then to filter it into our standard of care here. The focus has always been on quality of life and patient engagement. We were really surprised with how high the quality of life of our patients was. So it's not going to be a great outcome measure because we're not going to be able to see much of a change. We are talking about doing some at-home strength training type measures like a squat test, a push-up test, maybe a wall sit, a plank. Something that's very basic, but that we can do at home so that they don't need to come in for assessment.
Okay, right. Thank you.